very good morning. Welcome to another beautiful Wednesday. And of course, big thank you to Wahiga and his team. It is indeed the political season. Questions have to be asked and hopefully answered to satisfaction. We'll continue to borrow a leaf from another international journalist, keeping them honest, or at least we'll try. Well, every Wednesday we like to talk about health, nutrition, and today we want to talk about Figo. Kidneys, that's what we want to talk about, and allow my guests to introduce themselves. It is very good that also after International Women's Day, there are two women who are here, so Bazuna, my girl, them. All right, so I'll allow you to introduce yourself first.
Hello, everyone. My name is Joyce Bombengi. I'm a consultant physician and kidney specialist based in Nairobi.
All right, welcome to the show. And on this side... Hi,
Willis.
Hi.
I'm Joyce Awor. I'm a clinical nutritionist based in Nairobi as well.
All right, so two Joyces. It's a tale of two Joyces. And today, of course, if you have any questions around, kidneys, anything you've ever wanted to know about them, kidneys and kidney disease, if you've been suffering from any, if you want to know if you can survive with one, if you can't, you can feel free to ask the questions, and of course, you're going to get the answers here. They're going to give you the answers. Mimi ni dereva too. It's going to be okay. So first of all, let's start with okay, so anyway, it's still Joyce and Joyce. All right, there's a question up there. So what questions do you have about kidney and kidney disease? So you can go ahead and SMS 22422. That is our SMS platform, #Daybreak. And at Citizen TV Kenya, we'll be able to sample some of them and give you the answers. All right, so let's start with you, Joyce on this side. I say Joyce B. And
yes.
A.
Okay. Yes.
Yes. You see there?
Yeah.
Okay.
Yeah, absolutely.
Right. So what is kidney disease?
So kidney disease is a group of conditions, or rather there are a group of conditions in which the normal functions of the kidney are reduced. Okay. And you can divide them into two. There are those ones that happen acutely. It's called acute kidney injury, and there are those ones that happen over a long period of time called chronic kidney disease. So acute kidney disease normally is reversible, happens after certain events. For example, if you've had a lot of blood loss, people who've had really bad diarrhea and vomiting, sometimes you can get a really bad infection, an overwhelming infection. And even right now with COVID, we've had people having acute kidney injury because it's quite a severe illness. So for those patients, most of the time we institute measures. There's medical treatment that we can give, and sometimes including some sessions of hemodialysis, which we'll talk about as we go along, and we can reverse this. However, chronic kidney disease is a condition that happens over time. Most of the time, the patient will have had reduced kidney function over 3 months or more, and this comes when patients have chronic illnesses such as diabetes, especially if it's not well controlled or if they've had it over a long period of time, hypertension, patients whose weight is more than their height, patients who've had other conditions, malignancies, cancer of the cervix, cancer of the prostate, things that block the outlet of the urine, amongst others, or even conditions that affect the kidney. You've heard of things like lupus, connective tissue diseases, and people who take a lot of over-the-counter medication, alcohol, smoking, yes.
Yeah, alcohol. Every time we have this show on Wednesdays,
we have the discussion of...
You look at Kenyans on Friday or any other day, really, and you say, almost everything. Too much of it, anyway, too much of it is dangerous.
Yes.
Enjoy in moderation. Yes, I just had to throw that in there. But then, before even we go to kidney disease, I guess where we should have started is, and what many people maybe would have forgotten from either school or whatever, what is the function of the kidneys? What do they do?
All right. So I can start by saying most people are born with two kidneys, which are located in your upper back behind here. And the kidneys have so much more that they do just other than making urine, because most people just know that the kidney makes urine to get rid of excess water and waste products. But the other things that it does, you remember acids and bases in high school? When you take your food and your water, the body uses up what it needs for day-to-day working of the body, and whatever is broken down, the excess waste product comes out now as, the waste, we'll call it urea and creatinine. That's one of the things that we use to mark the waste. But you also form acids. So the kidney works by buffering and getting rid of that acid. In addition to that, you know about vitamin D. We get it in our food and the sunlight, and it helps us to absorb calcium from the stomach so that we can have healthy bones and all that. So that vitamin D has to be made active in the kidney. So if you have kidney problems, you will have problems with your bones, and you'll have problems with these minerals, calcium, phosphate, the things that are required for the bone. Another important hormone that it produces is called erythropoietin. It's a long, hard word. Long, hard word, but it's a very important hormone because it helps in the maturation of your red blood cells, the things that help you deliver oxygen and nutrients throughout your body. So people who have kidney disease most likely will have low blood levels, anemia. It also helps to control our blood pressure because when it gets rid of the excess fluid, then you have better blood pressure control. So there's so much.
So this, the bean-shaped organ does help a lot. Speaking about that, she's mentioned there are some, when it comes to nutrition, of course, people, there's this saying, I don't know if it's true, that ukitaka kujua what the specific food helps in, look at its shape and inasaidia whatever the part of the body. So like, for example, people say eat beans because it's shaped like the kidney, it's going to help the kidney. I don't know if that is true. Is it true?
Sorry, that's true because beans has a lot of fiber. As much as it has phosphates, but the phosphates that is absorbed in the body is kidogo. So it's part of the fiber that you say eat a lot of beans, get rid of your red meat because of the saturated fats and the acid. The red meat is very high in acid, as she said. You need an acid-base balance. So we talk about the plant proteins more than the
So this is the beans, your lentils.
Yes, your dengus, your peas.
So this is good for the kidney. And also she's mentioned vitamin D. You know, most people say vitamin D, ukitaka vitamin D, and what are the sort of food sources of it?
We normally call it the sunshine vitamin because mostly it's from the sun. But you can also get it from food. You can get it from fish. It's one of the richest sources from fish. Eggs as well. So
tuko sawa watu wa Kisumu City. Samaki tuko sawa. Omega-3, vitamin D, all of that is in there. So when you want to eat right for, because before, of course, the diet when maybe you now have a disease, but what foods can you also eat to kind of keep your kidney and just the processes healthy?
Mostly with kidney, we'll talk about a lot of water because it helps flush the kidney works better. We'll talk about less saturated fats, less processed meats, basically keep off the bacon, keep off the brawn, keep off the sausages, take a lot of plant-based...
So much pain, but good.
Take a lot of plant-based proteins as much as you can. If you're having your red meat, very lean red meat, and also the portion and the number of, the frequency also goes down.
So once or twice a week, probably?
Once or twice a week, If you can avoid, then we do the plant-based, and then you have your eggs, you have your dairy,
There's also another thing, when you talked about water, and when you're taking water, I don't know what is the recommended, because there are all these things out there. People walking with fuel tanks. saying, you know, we have to keep hydrated. So what is the recommended, because not dose, or recommended amount, because the other thing is, especially when sometimes you're losing weight, you hear terms like water weight. So like, and water retention and all that. So what's the recommended?
For my clients, I normally calculate for them. We normally do 30 to 40 mLs per kg per day. 30 to 40 mLs per kg per day. So we calculate according to your weight. We normally don't just do a blanket like 2 liters or 3 liters. It depends, because you can get a small person having 2 liters. Now it is too much water. And she'll talk about water retention in terms of sodium and all that.
Let's go to talk about water retention, because those are words we hear a lot. What is it? What is it?
Okay, water retention basically. So the kidney usually gets rid of excess water and excess and the other waste products, excess minerals, excess sodium, potassium, and all that. So when your kidney is not working well, or just in states where you've taken a lot of water, the fluid is, the fluid in the body is in different compartments. So it'll be in your like tissues, you'll get swelling of the face and feet. But I think you're talking about it in terms of the people who talk about detoxing.
Yes.
So they take these juices and things which make them pass a lot of urine.
Yes.
That's not actual weight, it's just losing the water and overworking your kidney.
Big time.
I don't encourage it.
Right.
But in addition to what you were saying about water intake, you know, when it's very hot, you will need to take more water. So there is a calculation what you can take for your weight, but when it's very hot, you will sweat more, so you'll be more thirsty and you'll want to take more water. But when it's very cold, you'll sweat less and you'll make more urine. And sometimes you just look at your urine. If your urine is looking concentrated, drink more water.
So if it's a strong yellow.
Yeah, drink more water.
Right.
Yeah.
And what if it's just water? Ukitoka tu unaona hii sasa ni maji.
You're taking too much. Actually excess water is not good. Yeah, you can actually get swelling in the brain. Yeah, you can get swelling in the brain, amongst other things. Your minerals can be diluted. You get low sodium, get confusion. It's not,
And it looks like the remedy for a lot of things. Look what easy, kunywa maji. What is kunywa maji?
But there's some symptoms that can show if you had dehydrated.
Yes.
Dizziness, headache, you're feeling lethargic.
Dry mouth.
So that will tell you that you need to increase your levels of water. But if your urine is quite colorless, now that's too much water.
Too much water you've been taking. All right, that happens. Juicing day 3. That what normally happens. The other thing you mentioned, you said that sometimes when you've had prolonged problems with your kidney. So how can one tell that? What are the symptoms? How can I tell that I'm not doing well? I need to probably go get checked. And it's about my kidney.
Okay. The thing about the signs and symptoms of kidney disease is that they're not specific to the kidney.
Okay.
Whatever you feel can be felt in other disease conditions. So let's start with, if you know the functions of the kidney, to get rid of excess water.
Right.
So if you're not getting rid of the excess water, you wake up in the morning, your face is swollen, your feet are swollen, some people get swelling around their abdomen, but this is not a specific symptom for kidney disease. It can also be heart disease, liver disease. So that in itself, when you wake up in the morning and you're swelling or you have lower limb swelling, just go and see a doctor.
How would you know if, apart from, because I know for the leg, ukifinya hivi na isiporudi,
yes.
So how would you know, like for the face?
For the face, normally it will come around the eyes, especially the lower eyes. So you wake up with a puffy face. Okay. Yes. And then another thing that will tell you that your kidneys are not working well. So so if you go for a checkup and they find that your blood pressure is high,
right,
it means that maybe the kidneys' primary function is to control your blood pressure. That's an indication that have a small check. Other things like nausea, vomiting, and they'll come with time. Excessive fatigue, shortness of breath. When your blood levels are low, you can't walk like a flight of stairs. You feel so tired, so short of breath. Generalized body pain. Some people get itchiness, and some people even get some white powder on their head when they've had a lot of urea. The excess waste product has been in the body for a long time. What I want to say is that these symptoms are not specific to the kidney. So when you're unwell, think about, are you really at risk? You want, especially people who have things like diabetes, hypertension, family history of kidney disease, a previous history of acute kidney injury. Remember what we talked about? Yeah, acute kidney injury. If you have any chronic illness that affects the kidney, get checked. Get checked.
And what would a check entail? What would it be? Blood or?
So a simple check for someone who's suspected to have a kidney disease, we'll start with the blood pressure. We'll take a history, ask you how you're feeling. Have there been changes in your urine? Is it frothy? Right. Like, people who, so the kidney is supposed to filter out bad things and keep in the good stuff, yeah? So there's some proteins that you start leaking in the kidney when the kidney is damaged. And when the patients will tell you that, I noticed that when I go to the toilet, when I'm passing urine, it looks like foam, like soap, yeah? That's one of the things. Have I lost your question?
No, you're on track.
Yeah. I said diabetes, hypertension, family history of chronic kidney disease. If you're a smoker, if you take alcohol heavily, and if you have any other chronic illness.
Yeah, how does weight affect? Because, you have... you are war on unsaturated fats, Joyce. Tell us how it affects.
Mostly when you have weight, a lot of weight as per your height, normally predispose you to diabetes and hypertension. Right. And those are the main causes that lead to kidney failure.
Yeah.
So we normally talk about weight loss all day, every day, weight loss. And also saturated fats. I can't stress this enough, you know. Right. Yeah, because there are things that can lead also to heart failure, heart diseases, cardiovascular events.
Right, and one of the things that people talk about, dread, of course, any sort of failure, but people talk about kidney failure. So what would you say, like now, what leads to like kidney failure, and how would you know that Sasa, one of your kidneys or all, I don't know, how would you tell? You're the doctor.
Wow. Thank you for that question. So, you know, the unfortunate thing is that about 80% of people will actually get chronic kidney disease and present quite late because they have very non-specific symptoms. Someone will present to hospital and say, you know, I've just been feeling tired for a long period of time. And, you know, when you do the check, you find that, wow, the kidney function is not so good.
Specific diets, and they say, if the doctor tells you there are too many ketones in your urine, ketones, inaonekana sana, or protein or whatever, is that an indicator of a problem, or just drink more water, or what happens?
Okay, so let me talk about ketones.
Right.
So you will get ketones if you've been fasting, or you've not intermittent fasting, or people who've not eaten, or in diabetes. Yeah, in diabetes they get ketones. Basically what it means is that you didn't have the insulin is not using the carbohydrates in the body, so it's breaking down your fats, and then now...
Which is a good or a bad thing?
Not so good.
Depends. Okay. You look at the patient as a whole, and then you look at it. Okay. So you can get the ketones if you've been fasting, or you've not been taking a lot of carbohydrates. Then the other thing about your proteins, so when you get proteins in a patient in urine, you have to go and measure a specific way. There's the one that we do, the urine strip. It's relatively about maybe 100 to 200 shillings in most places. If you see those proteins, it's usually good to quantify. And so you do it and then you repeat again. People who exercise a lot will get a bit of protein in their urine, but it's not necessarily a dangerous or a sign of sickness. You ask them to come again, do an early morning urine, especially like not when they haven't worked out, and then you compare. But you always correlate. Is there's protein in the urine? What does the patient have? Are there changes in the blood vessels in the eyes? Are there features of diabetes? Is there any other disease? Is there cholesterol high?
All right, okay.
And when you talk about proteins, there's a condition that's very common that causes kidney disease, especially in young children. It's called Nephrotic Syndrome. Those children leak a lot of proteins. Some of the causes are, like untreated sore throats, amongst many others. So those children they'll be looking perfect. They're the ones who will have the water weight. They're not growing as effectively as they should. Some of those indicators, when you see that child, you want to check the kidney function, just do a urinalysis, blood pressure, and check the amount of protein in the urine.
The more I do these shows, the more this annual checkup is looking like a very good idea.
It is.
The more you kind of have to, take a look at that. So if people start presenting some of the, diseases that are related to kidney failure, some of the acute and all that, so what kind of diet do you kind of put them on? What kind of nutrition plan are they on?
It normally depends on the stage of kidney where they're at.
Okay.
Because it can be acute kidney injury, so we'll normally check on your protein. You'll have to have a low protein so that you don't get your kidney to the chronic. Yeah, we'll now put you on a plant-based kabisa. And then we'll check on your water. And you're on dialysis and now you're chronic. Then I will give you high protein, but the type of protein depends. Yeah, we won't give you a high animal, high red meat protein. We'll do more of the chicken and the fish. Then we'll also do the plant protein as well. And then less water depending on your output. Then I will calculate and give you the water per day. Yeah. Okay. So you have to come with your lab work. We check. Yes. We also check your...
You come from...
Yes.
Dr. Joyce.
We work together.
Straight to Joyce A.
All right.
Yeah, so I check your labs. I check your potassium levels. I check your sodium levels, your creatinine levels. So I advise you as per your lab. So the interventions are very specific. There's no blanket intervention.
I'd like to also ask, because you mentioned, again, people who work out, because I feel like, you see, when you're working out, you you're on a pathway to, you know, this is my life, so I'm going to be better, I'm trying to be healthy. And there are many people who talk a lot about supplements, especially when it comes to protein. Something like whey protein. I don't know, what's your take on that? And can it be, like, I mean, the word is, you see, the problem I think is because it's supposed to be supplement.
Yes.
But people take it as the
main thing. Exactly.
Yeah.
So as you've said, it needs to be a supplement. So you need to have a diet plan.
Okay.
That where you get your main proteins from. Then you use the supplements as a supplement. But it depends on your weight. So we'll try and see, do you really need it? Yeah. So because you're in the gym, you need a lot of protein because you're building muscles and all that. So we'll calculate for you and tell you before you get to the actual supplement, which is powder, can you supplement with foods first?
Yeah, can you balance your diet? Because sometimes excess protein overworks the kidney. Anything that is overworked over time will, you know, stop working well. Yeah. Plus
the powders have overgone some processes, so they come back as harmful back to your body. So let's do food first, then we see, is there really a need for the powder?
And so what would be, again, excessive weight? Because the other thing is there are diets that also, usually like now the keto diet where you do no carbs and you're like, watch it to finye, white meat, and mboga, because of, what do they call it? White meat and mboga. Oxidation, yes. So is that something that's advisable to the for you know, the operation of the kidney?
I would advise you to take a balanced diet. This
is even if you're overweight.
Even if you're overweight, take a balanced diet. And there's something that we use for patients who have diabetes or chronic illnesses. There's a 6-inch plate. I wish we had carried it. That shows you, you know, first serve your vegetables. Make sure you put half of your plate to be vegetables. And of course, if you have chronic kidney disease, we'll tell you how to prepare your vegetables because the vegetables sometimes can have excess of certain minerals like potassium, which are harmful to your heart. And then your carbohydrate should be the size of your fist. Let's see the size. How much carbohydrate do you normally take? This is a good average.
Yes.
Individual fist. But it's my fist.
Now for you, we'll have to really calculate.
But you know, I'm not the expert.
Okay.
She is the expert.
So this is not, umasema size of fist naendo yangu.
A regular fist.
A regular. Okay, right.
Yeah, so we'll have to really calculate the carbohydrates for you as per your weight.
I've been just doing an ugali saizi. Kumbe nimekuwa nikifanya rongo.
You need to step into my office.
I will, indeed. I will. Okay.
Yeah. So, I mean, she is the expert, but when we're in the clinic and we're talking to patients, that's a rough way of telling them, you know, the protein should be like the size of the palm of your hand. Everything in moderation. Everything in moderation.
All right, so we have some questions here that I've been carrying. Let's take a look at what you want answered as well. Let's see. So there's, says, I always get sharp pains on my kidneys every time I'm angry or upset. Is it normal? What might be the cause? Also, at times, when I take coffee or strong tea, the pains at times get worse. Should I be worried?
Sharp pains around this area, they are worrisome. It would be important to know how often they get the pains. Is there blood in their urine? Because sometimes you could get kidney stones. So, and you can get kidney stones if you're dehydrated. We know that, yes, tea has oxalates, and it's one of the things that can cause kidney stones. There are many things that can cause kidney stones, but if you're not hydrating well...
And this tea is black tea or milk tea or just any tea?
Just tea.
Tea itself.
Just tea itself. If you're taking very high carbohydrate, you know, there are people who take supplements, they take a lot of calcium-based supplements that they do not require. Some people just have a family history of forming stones, and some people have recurrent infections, urinary tract infections that make them form stones. So sharp pains, that's something I'd be worried about. It would be very important to get a consultation with either a nephrologist or a urologist. That's a surgeon version of a kidney specialist.
All right. So, kuja kuone. Joyce, or how come you're recommending beans? Yet in practice is a fact that they are not good for kidneys. I don't know. Nanejita mwalimu.
Okay, with beans, you look at the phosphorus bioavailability. That is what we check.
Take Molimu to school. Go on. Yes.
Basically, with this, we look at how much phosphate will be absorbed in your blood at the end of the day.
Okay.
You understand? Okay. So if you're having beans in your githeri, now you can't really quantify your beans with your githeri, because normally with your githeri you do 1 to 2, meaning 1 cup of maize.
I don't know if people actually measure. Let's just throw it in.
Yeah. So normally it's a lot of beans to maize.
Right.
Now that will harm your kidney. But when you're looking at beans, you normally do a cup. Or rather, you'll come to me and I'll calculate how much phosphorus is in this cup and will it affect your phosphorus levels in your blood. So it depends. It has low bioavailability, but the fiber level is what you're looking at, which is good for your body. Yeah, so you'll have to come and I'll have to calculate for you.
All right. Brian from Mayakos, during cold days, why do I get kidney ache after taking the normal amount of water I take during hot days? That is Brian from Machakos.
Okay. Well, it's not very clear. I guess I'd need to get more information. Yeah, and then I'd understand. I think it would be better to get a proper medical checkup, blood pressure and everything. Then, and even just an ultrasound, which is a picture of the kidneys, we can have an idea of what's going on.
What's happening?
Yeah.
All right, so Brian, go get some check. Can eyes coloring indicate the condition of your kidneys that is yellow? Where do you go for checkup? And, well, how much can it cost? Kila Mkenya anataka kujua.
All right. Yeah. So when your eyes are yellow, most of the time, we call that jaundice. Most of the time it's because of certain things that come from the liver. That's not really kidney. That's more of liver. But when you have liver disease, we need to know why. So either way, it is important to go to hospital. They'll do the baseline investigations. There's something called a full hemogram. Tells us, it gives us a snapshot of what's happening in your body. Then we'll do a liver function test and the kidney function test, whatever else we need to do to find out why the eyes are yellow.
How much would a hemogram cost, roughly?
Well, in a public hospital, it costs anything between 800 to 1,200. Kidney function tests are about 600 to 800, that's in a public hospital. Of course, in a private hospital, it's different. I'd mentioned earlier that urinalysis, the price ranges depends on where you are and the type of strip they're using. So it can be anything from 200 to 800. Yes.
All right. Okay.
Yeah.
Just to add on the legumes part of the beans, you also need to soak your beans so that you can make it quite absorbable in your body. So it goes all your legumes, basically, from your beans to your dengu to your yellow beans, your lentils, all that needs to be soaked.
This is before you prepare.
Before you prepare, yes. After washing, you have to soak 4 hours if you're not doing, 4 hours before cooking, but the best is normally overnight. Overnight soaking is best. Then in the morning you pour out the water, rinse it off, and now boil. That way now you'll make it quite available for your blood.
All right, so soak the thing, man. Patrick Omondi from Kisumu Central Police Station says, can Dr. really explain about the colorless urine? Right.
So it can be, sometimes you've just taken too much water, but sometimes there are conditions where you can produce excess of urine. So when your blood sugars are very high, if you have diabetes, and there's another condition called diabetes insipidus. It's an entire topic. So normally people would make about 500 mLs to 3,000. If you're making more than 3 liters of urine, see a doctor. If you're making less than 500 ml of urine, see a doctor. Yes.
So what about frequent urination? Is that a good thing?
No, it's not a good thing. So there are many reasons why you can be having frequent urination. So when the kidneys make urine, your bladder should have a capacity of about 500. You can keep about 500, and then you start 500 mLs of urine, you start feeling the urge to go to the toilet. But if you have any irritation in your bladder from an infection, kidney stones, or if you have anything obstructing the way of the urine coming out. For example, when people have prostate enlargement, most people by the age of 40, the prostate is an organ. So you have your bladder, and then you have the urethra, which is a way for urine to get out. Around the urethra, there's the prostate gland. By the time people get to the age of 40, it starts enlarging in size, and when it's enlarging, it's like it's compressing the bladder, the urethra, the way for the urine to come out. So sometimes patients will tell you, I struggle to pass the urine out, and then so they pass out some remains, there's a lot remaining, so they keep going to the toilet often. Okay. Also people with kidney stones. So when you're passing urine frequently, that's an indication to go and
get some help.
Yeah, seek medical.
All right. The next one, okay. I was about to say blank. All right. Can persistent urinary infection cause kidney disease?
Yes, yes, especially in children. Children who have recurrent urinary tract infections, we usually send them to the urologist. They'll do some tests where they'll evaluate and see, why is this child having recurrent urinary tract infections? Are they having backflow? You know that the urine is not coming out well from the kidneys down the ureters. Is it flowing back? For adults, for women have a short urethra compared to men. And the urethra is very close to the part that allows the poop to come out. So it's very easy for you to get infections around, bugs coming up the urethra, especially in conditions of pregnancy, menopause, when you have other conditions like diabetes or when you're on certain medication. Right. So, yes, recurrent urinary tract infections, if they're not well treated, they go up. You can have it at the level of the bladder and can go up all the way to the kidneys. And if you keep getting them, you can even get an abscess or even scarring, See, sometimes when you heal in your skin, you can get some scarring, which is not good for the kidney. Yeah, so we usually investigate, find out the cause. If you keep getting the infections, there's some medication we can give you to take home long-term to prevent that recurrence. So see a doctor. See a doctor.
Maxwell from Kitui. Why is it that after kidney transplant, one is put on high-profile steroids, which is the other thing as well? Yeah, of course, that's a whole other thing. Kidney transplant and how many kidneys do you need? Can you donate and stuff like that? Yeah.
Okay, so I can answer them one by one. Okay. So you can live comfortably with one kidney. Okay. So if Willis, today someone says, hey, I need your kidney, family member, you're a good match. Okay. We will prepare you. All right. And if you're willing to give your kidney, you'll give the kidney and you will live well with the kidney. Okay. As long as you do not have any other predisposing factors. Okay. Number two, it was about why do they use high steroids? Right. So your body knows itself. There are white cells. White cells are the ascaris in the body, yeah? They know, they go around surveilling, yeah? They know this is part of me, this is part of me, this is part of me. So when you get any infection or you introduce something foreign, they attack it. So when you get a new kidney, even if, like the best match would be if you're my identical twin and we're exactly the same. But most of the time you'll get a kidney from a family member, and in other countries they get it from, something called cadaveric transplants from other people who are non-related. Right. So when you put this kidney into the body, it can be rejected, it can be attacked. So the steroids, they calm down the soldiers to ensure that the kidney takes and it works well. So you take them for a long period of time. So when you initially get the kidney transplant, you'll be put on very high dose steroids. But as we go along, we calm down until we are on a very low dose. Right. Just something to keep things going. Yeah.
And after the transplant and such procedures again, what does sort of the diet look like?
Oh yeah.
Yeah. For the diet, we'll normally talk of we'll talk about your protein. We'll talk about low protein diet, because now your kidneys they're good but not best, so they're just in the middle. So we'll talk about your low protein diet, high vegetables, but the type of vegetables as well, also check on them. We'll tell you how to prepare vegetables so that you get the right iron.
What would be the right way?
Because most green leafy vegetables are high in potassium. Yeah, because potassium is mostly in fruits and vegetables, but the greener the vegetable, the higher the potassium level. So we'll talk about something called leaching process, where you soak your vegetables. After washing, straight from the market, you wash, then you soak them. Either 4 hours.
That's in plain water.
Yes, plain water. Yeah, plain room temperature water, not hot or cold. Right. Yeah, so you soak them for at least 4 hours, then you drain off the water and then you boil. So in your boiling, normally we talk about your water should not reach to your food level. So you keep on adding the water until the food is cooked. Then now you pour out the water, either you serve boiled, or you fry, yeah, yes.
All right, so just, low protein, high vegetable.
High vegetable, then we'll talk about either the whole meal, whole grain, or the white grain, depending on your body now.
What's like an example?
Example of whole grain would be now the wimbi ugali, your brown kate. You'll go mostly and do the viazis, the nduma, the ngwashes. Those are best for you because of the fiber.
Fiber ni mzuri sana. Kuna fiber kwa mango?
Yes,
na pawpaw.
Yes. There's also fiber in fruit. So those stringy thingies you see on fruits, those are fiber.
Yeah, all right. So my mom was right. Eat this; it will help you when you need it. All right. Isaac Kimaru is saying men should eat red meat. Is it really dangerous? What's the safe level? I told you this red meat thing is gonna come. You know, yeah.
Red meat in regards to kidney is high acid, and we're looking for the acid base. So we don't really cut out red meat completely. We talk about 2 times in a week, and then we talk about the portion. But red meat.
So if you have, say, and I'm thinking about a typical Kenyan situation on a weekend. So if you have nyama choma on Friday, unafungia hapo. And then maybe have it on Monday.
There's those cheat days that you want to go and maybe have a feel.
Right.
But not every other week, not every other day. But go, if you're having your Friday, go for chicken. Si lazima ikuwe nyama choma. Go get your chicken. Last time we talked about the high temperature meats.
Yes.
And your nyama choma is exposed to very high temperatures of heat. So it will lead you to so many more things than just kidney. So look at your chicken. Have them slow cook it, because last time I was being asked, so tusikule nyama choma nini. So when you're doing nyama choma, just try and marinate it so that it is coated and not very exposed to high heat. Then cook it slowly. See, ile unafika 30 minutes unataka chakula imeiva. Now that does.
Wenyewe unafikanga huko unasema ita take how long? Unasema 45 minutes. Hapana. Wewe fanya na 30.
No. The 45 minutes is way better than 15, yeah.
Okay.
Yeah, then portion.
And Willis, about the nyama choma, something that we have forgotten to mention with kidney disease. Well, every time you go to see people eating nyama choma, they have that big pile of salt.
Yes. Wow.
That's a problem. That's a problem. Because you shouldn't take too much salt. In fact, you should not be adding salt onto your food. That excessive salt, it overworks the kidney, causes problems, makes your blood pressure go up.
Yeah.
Yes, so let's avoid that.
So how do you then, you prepare, you infuse it as you're cooking?
Yes,
as opposed to adding?
As opposed to adding, but if you have hypertension or your blood, your sodium levels, you've been told they're high, there are spices that you can use that can make you have that flavor without having the excess salt.
What about people say these days if you go to the market, there's some special salt. Sea salt, iodized salt. Yes.
Actually, we did a survey. We went and took photos of the different sea salt, what salt, and looked at them and looked at the amount of sodium. They're almost all the same. And then the one that they said was non-sodium based was potassium, which was very dangerous. It's actually quite dangerous for patients with kidney disease. So everything in moderation. The most amount of salt. So patients who have kidney disease, we tell them the most you can take in a day is 2 grams of salt. So remember,
2 grams is like
2 grams is like a teaspoon.
A full teaspoon.
A full teaspoon. But remember, this is the entire day.
Oh, okay.
Morning.
Yeah, from morning. Remember, in the morning, your bread, when they make bread, they put in a bit of salt.
Yes.
Then you probably have an egg with a little bit of salt.
Yes.
Then you have your lunch.
With some salt.
Yeah. And you add ketchup. How much salt is in ketchup? You put in your soy sauce. So there's plenty of salt in sodium in most of our foods. People who eat canned foods, those processed foods, you talked about them. They use a lot of sodium when they're processing and trying to keep it preservative. That's the word I was looking for in the preservative. So low salt.
Low salt. So less salt be?
No.
Tumekata.
Nusra. All right. Kemboy from Kitale is asking, I want to know if it's true that if I continue using diclofenac tablets for a long period, it can damage my kidneys.
Yes. So painkillers, especially diclofenac, is a type of group of painkillers called NSAIDs. There are other relatively less dangerous painkillers, though even paracetamol itself, if you take it in excess, can cause damage to the kidneys. So you're supposed to take these painkillers for a short period of time, alleviate the pain, and stop. So under a doctor's advice, they will check you, and they will always check the blood test to see, is this painkiller of mine causing a problem? Yeah, so those people who are always at the over the counter, maramoja, sijui nini, I don't want to mention all those painkillers, but I'm sure you know someone who's always buying painkillers, and especially when he's talked about diclofenac, I know many patients who usually come with gout. When you have gout, please check the kidneys.
Yeah.
So because that gout is caused by excess uric acid, and uric acid can also cause damage to the kidneys, or even the kidney problem can cause gout. But when they keep taking this diclofenac, when they wake up in the morning with a painful toe, they run to the pharmacy, they take the diclofenac.
I'm just hangover. 1,000 mg.
1,000.
Dissolve. Unakunywa.
There's a problem. Yeah, that will give you problems. Yeah,
it will bring some problems there, people, so be careful. Someone's asking, do fruits take part in cleaning of the kidneys? I don't know what the cleaning would mean, but yeah.
Cleaning of the kidneys, but it depends which fruit, because fruits have high potassium as well. So if you you need to check on the type of fruit.
So bananas?
Bananas is a no.
Bananas have high potassium.
Banana and avocados are the no-go zone for kidney patients. Yeah, but it also depends on things like grapes. If you have 6 pieces of grapes, that's good enough. But if you go and have a whole bunch, now that is